Hey everyone, welcome back to the channel. I am Dr. Z, a clinical psychologist specializing in transgender adults and gender dysphoria. And today we're tackling a topic that comes up constantly in my practice. And if you're a provider and you're watching this, I would not be surprised if this comes up constantly in your practice as well. And that is the difference between body dysmorphia and gender dysphoria, and what happens when they overlap. This is an important topic because these two conditions are often confused not only with each other, but also an understanding of the differences impacts how you get help and what kind of support actually works. So stay for the entire video because not only am I going to go over very distinctive differences and examples to help you understand the difference between body dysmorphia and gender dysphoria, but I'm also going to give you questions to ask yourself if you, as a viewer, struggling, trying to understand how much of what's happening to you is body dysmorphia versus gender dysphoria, or perhaps both of them are coexisting. Now, keep in mind, none of this are going to be perfect assessment, nor is going to be a substitute for actually sitting down with a mental health provider, preferably somebody who specializes in gender dysphoria, to really have a full thorough assessment. But this definitely is going to start helping you understand these vital differences. So without further ado, let's dive in. So let's start with gender dysphoria, since most of you, actually every single one of my viewers, brought to this channel because you're struggling or presume you're struggling with gender dysphoria. Gender dysphoria is a distress. It's a psychological distress that comes from the mismatch between your gender identity and the sex you were assigned at birth. The key word here is mismatch or misalignment. The important thing is that it's not about thinking your body is ugly or flawed. It's about your body not aligning with who you are. Here's what gender dysphoria looks like: distress about primary or secondary sex characteristics that don't match your gender identity. Feeling like your body doesn't belong to you. Some describe it like you're wearing a wrong bodysuit. Strong desire to be rid of certain physical features because they feel wrong for your gender. Discomfort when others perceive or treat you as a wrong gender versus the one that authentically resonates with who you are. Deep relief when you're able to present or be recognized as your actual gender. Feeling like something fundamental is misaligned. And in this case, again, it is your gender. The key is it's about gender, not aesthetics. Let me repeat, this is crucial distinction. Gender dysphoria is about gender, not aesthetics. Let me give you an example. A trans man might look at his chest and think, this is perfectly nice chest for a woman, but I am not a woman, so it doesn't feel right in regards to my gender. Do you notice the difference? He's not saying breasts are ugly or bad. He's saying they're wrong for him because they don't match his male identity. Another example is a trans woman who might look at her facial hair and feel profound distress, but not because facial hair is inherently unattractive or bad, or there's anything wrong with having facial hair, but because it makes her feel like that's a masculine attribute and is not aligned with her feminine self. Again, here's the important distinction. For most people with gender dysphoria, gender affirming care actually reduces distress in a form of hormone therapy, gender affirming surgery, social transition, legal transition, just stepping in and starting to express yourself and shifting maybe the way you navigate your life in regard to your authentic gender and all other parts of gender transition tend to make people feel much more at home in their bodies, not less. This is also an important distinction that I'm going to repeat. Treatment tends to relieve distress of gender dysphoria versus making it worse. That relief and alignment is a key feature of gender dysphoria treatment, whereas with body dysmorphia, no amount of intervention really brings relief because, as you will see, body dysmorphia is an obsessive, oftentimes very borderline delusional disorder where somebody perceives something about themselves that somebody else is not really present. So let's now dive into body dysmorphia, or sometimes called body dysmorphic disorder. Body dysmorphic disorder or body dysmorphia is a mental health condition where someone becomes obsessively preoccupied with perceived flaws in their physical appearance. Flaws that are often minor or not even noticeable to other people. Here's what body dysmorphia looks like. Obsessive focus on specific physical flaws, spending hours thinking about them daily. Compulsive behaviors, checking mirrors constantly or avoiding mirrors entirely. Excessive grooming, seeking reassurances repeatedly from others. Comparing yourself to others obsessively. Believing that everyone notices and judges your flaw when most people don't see it. The flaw often changes. For example, if you fix one thing that you're obsessed about, for example, you're obsessed with what you see as minor imperfection with your nose, and you get a plastic surgery, it doesn't solve body dysmorphia because suddenly another feature becomes the problem. Significant distress that interferes with work relationships and daily life. Perception of the feature is often distorted. That's another key. For example, a person literally can't see what they actually look like. And what they consider a major flaw is not evident to others at all. The key difference here, body dysmorphia is about perceived aesthetic defects, not about gender identity. Now, someone with body dysmorphia might be obsessed with the size or shape of their nose, their skin texture or complexion, muscle definition or body size, hair thinning or hair texture, symmetry of facial features, and any perceived flaw in their appearance that has to do with aesthetics. These concerns are necessarily aren't, I'm sorry, these concerns are not necessarily related to gender. I will talk to you when they overlap and what they look like. They're about thinking a person looks defective, they think they look ugly or deformed in some way. And the important thing is that what they perceive as a flaw, a deformity, ugliness, to an average observer, that would not be the case. So there is a distortion going on. There's a distorted, obsessive perception of the self that if you were to line up this person with 1,000 other people, they would all say they don't see what this person sees. So here's a really important distinction again, just to kind of drive it home. Body dysmorphia typically doesn't get better with cosmetic changes. In fact, getting plastic surgery often makes body dysmorphia worse because the person focuses just tend to shift to a new perceived distorted flaw. So let's say, for example, someone with body dysmorphia gets rhinoplasty, a nose job. They might feel brief relief, but then they become obsessed with their chin or their ears or something else entirely. The problem isn't actually the body part. That's important. With body dysmorphia, the problem is not the body part or fixing that body part. It's obsessive, distorted thinking patterns. Again, the problem isn't about the body part. It's obsessive, distorted thinking pattern. People with body dysmorphia often genuinely cannot see themselves accurately. They might be objectively attractive, but they see themselves as grotesque. The perception itself is distorted. This is why a lot of times body dysmorphia is seen as a delusional aspect of disorder, because a person is seeing themselves not in a way objectively anybody else would. So let me break down the core differences even more clearly. Gender dysphoria is about gender identity, not aesthetics. The feeling a person often feels is, this body part feels wrong for me because it doesn't match my gender. What often helps is gender affirming changes, social transition, hormone surgery, other aspects of gender transition. And distress is specifically about gender related features, not aesthetics. Perception in that individual is, you can usually see your body accurately, but you just know it's not right for your gender. And relief comes from alignment between body and gender identity. Example: I hate having breasts because I'm a man and men don't have breasts. Do you see the difference? It is tied to gender. Now, body dysmorphia is about perceived physical defects, not gender. The feeling a person feels is, this body part is ugly, wrong, defective, abnormal. What often helps is some form of therapy, usually cognitive behavioral therapy, maybe some medication, but cosmetic changes often make it worse. Sometimes it can be about physical features, and in terms of perception, the view is often distorted. A person can't accurately see what they look like. Relief doesn't reliably come from physical changes. Obsession tends to shift to a new feature. Here's an example. My nose is huge and deformed, and everyone stares at it, when my nose is actually normal sized, and objectively everybody would say there's nothing wrong with it. Here's another way to approach the distinction between gender dysphoria and body dysmorphia, by utilizing the why question. And later I'm going to give you even more specific questions. With gender dysphoria, for example, why does this bother me? If the answer is because it's a gender thing, this feature makes me as the wrong gender, it relates to the wrong gender. Whereas body dysmorphia, why does it bother me? Because it's ugly, defective, wrong, abnormal, not specifically about gender. So again, gender is going to be square one. Now, here's another way to look at it. Imagine you wake up tomorrow and the feature you're distressed about has magically changed in the way you want. If it's gender dysphoria, you'd probably feel profound relief and alignment. Almost like, yes, now my body matches who I am. This feels right. On the other hand, if it's body dysmorphia, you might feel temporary relief, but the obsessive thoughts would likely shift to a different feature. The underlying anxiety wouldn't actually resolve. Within weeks or even months, a person will find a new flaw. Now, keep in mind again, this isn't a perfect diagnostic tool, but it can help you start to differentiate. And again, I'm going to go over even more specific questions later in the video. Here, very important, here is where all of this gets very complicated. Yes, you absolutely can experience both gender dysphoria and body dysmorphia. Being trans doesn't make anybody immune to body dysmorphia. So let's explore how overlap between body dysmorphia and gender dysphoria might actually look like. Let's say you're a trans woman and you might experience gender dysphoria about facial hair because it's a masculine feature that you feel triggering your gender distress. You might also experience gender dysphoria towards voice steps because it marks you, you perceive it as marking you as masculine, right? It tends to be, not tends, it is socially a masculine feature. Plus, you also have body dysmorphia about the exact shape of your nose, and you're obsessing over details unrelated to gender. And you also may have gender dysmorphia about one of your eyebrows because it's slightly higher than the other and not noticeable to anybody else. Do you see the difference? The two can coexist. The dysphoria is about gendered features. The dysmorphia is about aesthetics details that aren't actually about gender. They're about perceived defects. So how do you differentiate when you're experiencing both? One, you can ask yourself, is this about gender or is this about aesthetics? For example, my hands feel wrong because they're too small, too large for my gender. Likely dysphoria. My hands are ugly and everyone judges them and they see them as something that completely grotesque. Likely dysmorphia. Another thing you can ask yourself is, would I feel this way about this particular feature of mine if I were cisgender? If yes, it might be body dysmorphia. If no, it's probably dysphoria. Another thing you can ask yourself, am I obsessing about this in a way that interferes with my life? Spending hours checking mirrors, avoiding social situations because of this feature, you can't stop thinking about it. It could be body dysmorphia. Now, is it distress that's specifically triggered by gendered situations or misgendering? Likely dysphoria. Another thing you can ask yourself is my perception of this feature accurate? If you genuinely can't tell what you actually look like, if photos surprise you, if others say they don't see what you see, this might suggest body dysmorphia. If you can see yourself accurately, but it doesn't match your gender, dysphoria. Again, a person with gender dysphoria does not have a delusion about a particular body part. They know that the body part is otherwise objectively fine. But it brings them discomfort precisely because it's not aligned with their gender. It characterizes the gender opposite of how you identify. Another question to ask yourself, what would fix this? If this, for example, if this body part matched my gender, and your answer is, I would feel better if that were to happen, that's most likely dysphoria. If you ask yourself if this body part looked perfect, normal, symmetrical, I'd feel better, but then another flaw appears, it's probably dysmorphia. Now you might be thinking, okay, but why does it even matter what we call it? What if somebody is suffering either way? Whether they have body dysmorphia or gender dysphoria, what does it matter how we classify them? And you're absolutely right, suffering is suffering. But the distinction matters because the treatment approaches are different. For gender dysphoria, treatment is gender affirming care in the form of hormones, surgery, social transition, legal transition, all the other aspects of gender transition, even including therapy and a form of acceptance. These interventions typically reduce distress significantly. And if you're watching this and you are going through transition or any aspects, you know that stepping into treatment has helped reduce gender dysphoric distress. Therapy also can help tremendously with coping and navigating transition. And the goal is alignment between body and identity. Most individual adults that I work with who go through gender transition, and I feel like they got either close to alignment they were looking for or as close to alignment, are without a doubt have a tremendous sense of relief from gender dysphoria. Somebody with gender dysmorphia will not feel that relief. So for body dysmorphia, for example, the treatment is very different too. Treatment most likely is going to be cognitive behavioral therapy. That's the most effective. Sometimes some kind of medications come into play. Maybe exposure and response prevention therapy might be helpful. But surgical interventions often make things worse. And the goal is to change thought patterns and reduce obsessive behaviors versus actually changing physical characteristics. And here's why. Getting this right matters. If you're pursuing gender affirming medical care, but you also have untreated body dysmorphia, you might find that transitioning helps with your gender dysphoria. Great. But the obsessive thought patterns about your appearance don't go away. You might develop new obsessions about whether you pass or about features you can change. You might keep finding new flaws even after transition. Now, this doesn't mean you shouldn't transition. It means you also need support for the body dysmorphia component. Good gender affirming healthcare providers should screen for body dysmorphia, not to gatekeep your transition, but to make sure you're getting all the support you need in case if two coexist, and a lot of times they do. You can also pursue gender affirming care while also working on body dysmorphic patterns. They're not mutually exclusive. In fact, addressing both often leads to the best outcomes. So, what do you do if you think you might be dealing with both gender dysphoria and body dysmorphia, or if you're not sure which you're experiencing? Here's what I would recommend. Find a trans-informed therapist who also understands body dysmorphia. Often this will be someone who is specialized in gender dysphoria like myself, or at least semi-specialized. This is crucial. You need someone who understands and affirms your gender identity, also knows how to screen for and treat body dysmorphic disorder, won't use body dysmorphia as an excuse to gatekeep your transition, and can help you navigate both simultaneously. So let me summarize what I want you to take away from this. There are different conditions, both of them, body dysmorphia and gender dysphoria, are different conditions with different treatments. Gender dysphoria is about gender identity mismatch. Body dysmorphia is about obsessive focus on perceived aesthetic defects. The distinction matters for treatment. They can coexist. You can have both. Being trans doesn't make you immune to body dysmorphia. Having body dysmorphia doesn't mean you're not trans. Both deserve treatment. You shouldn't have to choose. Try to get support for both conditions. Understanding the difference helps you get the right help. Knowing which is which, or if you have both, help you access appropriate care. You're not too complicated. If you're listening to this and you're thinking, oh my goodness, I have both. Many people in trans community navigate both. And one of the reasons is because long decades, years living with gender dysphoria, a lot of times can sip and start creating body dysmorphia. Both coexist. So if you're watching this and feeling seen, know that you're not alone. Like I said, many people experience both or struggle to figure out which they're dealing with. The confusion is very understandable. These conditions can look similar from the outside and they can both be incredibly distressing. What matters is that you deserve support that addresses what you're actually experiencing, not a one-size-all approach. So if this is helpful, Please make sure you like this video, make sure you subscribe, it helps the channel. Drop comment below about your experience, if you're comfortable sharing with body dysmorphia or gender dysphoria, if you found that they overlap for you, or if you thought it was, for example, if provider thought it was body dysmorphia, but it turned out gender dysphoria. Resources are in the description box, including an in-depth self-assessment workshop from me on whether you have gender dysphoria, all below. Thank you as always for being here. Take care of yourself, and I will see you all as always in the next video. Goodbye.